Hi everyone, and welcome to this webinar using the My Health Record in Residential Aged Care. My name's Ali Sullivan. I'm part of the education team here at the Western New South Wales PHN. And thanks for joining us today. Today's presenters, we have Lisa Bowes, who is the Digital Health Support Officer, along with Brenton Jones, our Senior Digital Health Officer here at the Western New South Wales Primary Health Network. Just a few housekeeping. If you have any questions, you can put them in the chat box today and we'll address them at the end. Everyone's on mute. We are recording this session and it will be on demand on our website. And if you're viewing on a shared device, please type each viewer's name into the chat so your attendance is recorded. If you could please complete the evaluation form after the session as well, that would be great. Thank you. So I'd just like to acknowledge the grounds we're meeting on today is Wiradjuri Nation, and I'm in Dubbo today. I'd like to acknowledge that we work on the traditional lands of many Aboriginal nations across Western New South Wales and pay respect to elders past, present and future. I acknowledge their continuing connection to land, water and culture and their contribution to help shape the life of communities in which we all work and live. And I welcome all Aboriginal and Torres Strait Islander Australians who are present in this meeting. I'll now pass over to Lisa Bowes, who'll continue for the rest of the recording. Thanks, Lisa.
Thanks, Ali. Welcome, everybody, and thanks for taking time out of your busy day. I just wanted to run through a couple of the objectives. So we're going to be providing an overview of My Health Record, and within that, we wanted to be able to recognise some of the types of different documents held in My Health Record that can assist communication, residents' health information, and continuity of care between healthcare providers. Also describe some advantages in using or benefits in using documents in the My Health Record for sharing of health information during transition of care, and review how your organisation may currently access and use My Health Record, and also identify processes required to register access to My Health Record. Thanks, Ali. So what is My Health Record? So My Health Record is a summary of an individual's key health information. It is personally controlled, which is a key element of the system. What this means is that an individual has a say as to what gets uploaded, what stays in their record, and who can see their record. Importantly, My Health Record is part of a national system, which means that the individuals and My Health Record travels with them wherever they are and no matter which registered healthcare provider they are seeing. A resident's My Health Record is accessible at all times, including at the point of care, by the resident, their representative, and healthcare providers who are involved in their care. The resident's record can be viewed and added to, however, this is subject to access control set by the resident. My Health Record is private and is protected via legislation, the My Health Records Act 2012. It's secure through multiple layers of international best practice in IT security. For example, there is a cybersecurity team which monitors, maintains and improves the system 24/7. Next slide, please.
My Health Record is a secure online summary of a person's key health information. This includes information from GP records, pathology tests, diagnostic imaging, hospital records, Medicare, prescribed medicines, and information uploaded by individuals themselves. Making sure that you can quickly gain an understanding of a person's health history can assist in the treatment of chronic and complex medical conditions, reduce medication errors, and prevent the unnecessary repetition of tests. This all helps you to focus on the person, rather than looking for the information that you need to treat them. My Health Record can save lives and improve patient safety by protecting against potential errors. These may be caused by needing to make clinical decisions without knowing a person's history. If you're authorised by your organisation and you are involved in a person's healthcare, you can view and upload information into their record. This not only allows you to access any information that has been uploaded by other healthcare professionals, but also allows you to upload healthcare information you have recorded. This helps to ensure that the person's key healthcare information is available when needed. Record is a secure online summary of a person's key health information. This includes
Just a second. Thank you. Thanks, Ali. So the next slide, please. So he's going to talk a little bit about the My Health Record documents. So there are different types of documents held within My Healthcare Record. So this slide shows you the list of available documents in My Health Record. There are 3 sources of information that are entered into My Health Record. There are healthcare provider entered data, which are clinical documents such as health summaries, discharge summaries, pathology results, and specialist letters. There are also Medicare sourced information, which includes Medicare benefits and Department of Veteran Affairs item numbers, pharmaceutical benefits scheme claims, Australian immunisation register data, information recorded on the Australian Organ Donor Registry, and My Medicare information. And then lastly, there is consumer entered data, such as personal health summaries and advanced care planning documents. And at the bottom of this slide, you'll notice some new functionality, which is coming soon, that's specifically designed for use by residential aged care facilities. One of these is the residential care transfer reason. It's a document generated by a residential care facility containing details of an individual's transfer from the residential care setting into a hospital. This includes provider information, reason for transfer and date of transfer, and the upload of this document triggers the creation of a residential care transfer overview. There's also a residential care medication chart that's coming soon, which is a record of orders and administration of prescription and non-prescription medicines and nutritional supplements for an individual being transferred from a residential care facility to a hospital. And lastly, the residential care health summary. So this is a document containing information about a residential care individual's environment, health, and care to support continuity of care during their transfer to a hospital. And I will be able to share a concept design of the residential care transfer summary at the end, towards the end of this video, toward the end of the meeting. Next slide, please. So this slide sort of demonstrates some overviews. So inside of My Health Record, there's all different types of views. There's overviews and views. Then what My Health Record system does is it brings all available information together and displays it in a format of views and overviews. To assist healthcare providers with easily finding the most relevant informational documents, the system generates consolidated views, which is shown on this slide. These include prescription and dispense view, medicines view, Medicare overview, immunisation consolidated view, along with pathology and diagnostic imaging report overviews, and soon to be coming residential care transfer overview. Next slide, please. Next slide. So the benefits of what are some of the advantages and benefits of My Health Record. So My Health Record offers aged care providers an advantage by conveniently enabling prompt access to accurate and relevant health information about residents. For frail elderly people living in residential aged care facilities, having access to appropriate and timely healthcare is a priority. Using My Health Record to share key health information with healthcare providers offers significant potential. It can save time spent gathering information from multiple sources because key health information is streamlined into one location. Can help avoid duplication of tests and diagnostic imaging, which is a waste of resources. Can also help support decision-making for clinical teams. Can help improve continuity and coordination of care between aged care and healthcare systems. And it can save time in an emergency. And for the individual, basically they can have some enhanced patient self-management. They've got access to this. The next slide, when we have an aged care nurse, Sue Emerson, she talks about some of the benefits of My Health Record in aged care.
Older people are really surprised that the systems don't talk to each other. There's also an assumption that we can access their history, their health information, that systems do talk to each other and that we all share comfortably. That really hasn't been the case as easily as it is now with the My Health Records. We can have access to things like vaccinations. Influenza vaccine has become an incredibly important protective thing for people who are ageing and living in residential aged care and in the community. So, having that sort of immunisation record, having access to pathology, and having access not just to a list of medications that have been ordered, but to actually be able to see those that have been dispensed. It doesn't tell us if the medication has been taken, but it's another part of the picture that we can see that medication that was ordered has been dispensed, and then we can speak to the person themselves about whether they've taken it and how they're finding their medication. People are wanting to stay at home, and the My Health Record will follow them and be there in the background wherever they may go, be it relocating to another state, be it travelling on holidays, intrastate or interstate within Australia. The My Health Record goes with them. And then in those health bumps, those times when we do need to touch the public health system, perhaps with an admission to a hospital, or the private health system, or day surgery. Older people are going to be staying in the community longer, and this record is going to follow them and really address those concerns around, why don't you know my history?
So, My Health Record is a great digital tool. It contains a lot of information that can support clinicians, but you might still be wondering how it can add value to your clinical practice. So, access to the medication allergies information in the Medicines View provides key information that can help facilitate medication reconciliation tasks. We know that this in turn plays an important role in reducing potential medication errors. Access to a resident's medical history, for example, in a shared health summary, can also help facilitate assessment for healthcare staff, saving them time having to collect the necessary information or having to rely on the resident's ability to be able to recall their medical history accurately. And remember, the My Health Record is not designed to replace other sources of information available to you, but rather to enhance the information available to you. Also, My Health Record is a great platform for giving residents the ability to share information, such as their advanced care planning documents, which clinicians can access to be able to understand and comply with their end-of-life care decisions. So in the next video we'll play, we've got some aged care staff, residents and medical professionals that talk about how digital health tools and access to digital health records, such as My Health Record, are playing an important role in the care for their residents.
Because it's a quicker process. One of the reasons digital health is so important in residents coming into care is there's a lot of pieces of information coming from a lot of places, and sometimes they're not always accurate.
Like, we don't really know their past medical history that really correctly, and we sometimes don't really know the exact medications they are taking.
We have to do a lot of detective work. There's no one source of truth that we can go to. It's often trying to gather information from multiple sources in multiple ways, which can really be time consuming. Not having that information is a real barrier to providing effective care.
So if we can get information digitally from My Health Record, it's much easier for us to transition them in.
Having a single source of truth like My Health Record is just so critical.
My mother-in-law only speaks Cantonese, and it is very, very important that they have access to her health record digitally, so that anyone who needs to look after her health know what to do, where to look for it, what she needs.
We can just pull up the record and know all the medical histories, which is important for us to provide the best care for them. My Health Record is going to continue to enable us to provide the best health care for our residents. That is something that I look forward to in the near future.
With the help of e-prescribing, when I contact doctor to get something charted, it's quite easier. They can easily go into the name of the resident and can chart the medicine that they need.
E-prescriptions have improved the practicalities or the impracticalities of paperwork of the old scripts in terms of getting a piece of paper from one place to another, and that's been a big help, no doubt about that.
Digital health helped us to pack these medications in a very safe manner and at the same time very accurate and efficient, so our residents can get their medication on time.
Digital health is a real game changer for everyone who works in residential aged care facilities. For us, it gives us accuracy in administration, especially for medication, need a precise timing.
The doctor is able to prescribe electronically from their phone or from the facility, and that electronic chart then translates straight through to the pharmacy and straight through to the facility. Being able to have those technologies in the store and being able to capitalise on them is priceless.
With the electronic scripts, we don't have to worry or think too hard about it.
係啊，我好喜歡現代科技㗎。我覺得佢哋喺個電子記錄裏邊咧，都能夠了解到我用乜嘢中藥或者藥油，咁對於我嘅健康咧更有幫助。
And the patient can upload the traditional medication they are taking onto their My Health record. From there, I can better give advice and give a better treatment based on what they're taking, what their beliefs are.
The global pandemic provided aged care with some additional challenges and risks. It also provided us with some great opportunities. So we were able to accelerate the use of telehealth and e-consultations.
For our residents like Philip, telehealth has been actually crucial for him to still have accessible access to his doctor. It puts all the clinicians on the same page, which allows us to treat and manage the complexity of our clients more effectively.
That is bloody great technology, isn't it? The neurologist said to me when I was talking to him, "What medications are you on?" And I said, "I can't tell you. I don't know." Goodwin can instantly send him over the list and he knows exactly what I'm on, and he then takes that up with my GP. Digital health has allowed me to get the care I need without leaving my room.
I can't wait one day we can have one single system with my health record, with all the necessary information under one umbrella, accessible to everybody, to support us to provide the best care for our residents.
I'm really excited about a future where digital is not a new thing, it's just part of what we do, it's just part of healthcare.
My hope is that digital health will provide a better health outcome to all residents in aged care.
Digital healthcare should just be the way we do health. We do it in every aspect of our lives. Everyone has smartphones, everyone uses apps. So we need to move to a place where that's just part of how we run the health system. It's connected and it's much easier for people to navigate and to get the care they need because everyone knows their care needs.
而家有一個電子記錄咧，可以好方便咁樣同我屋企裏面溝通，幾好。
Thank you. There's some additional resources there on accessing My Health record. So how do healthcare providers and consumers utilise My Health record? So healthcare provider organisations need to register with Healthcare Identifier Service to be able to access the My Health record system. Their authorised staff are then able to view and upload to My Health record via conformance software, which means compatible software. Or if the software used in the organisation is not conformant, then authorised staff can access My Health record via the National Provider Portal, which is a web-based viewing-only platform. Consumers can view their My Health record via MyGov link services or authorised apps such as the My Health app. To add information to their record, they actually need to go to the My Health record via MyGov. They can't add information via the app. So the next slide, we're going to talk a little bit about what is My Health app. So basically, it's a patient-facing consumer application developed by the Australian Digital Health Agency. It can be used by the My Health Record owner or holder, as well as any authorised or nominated representatives they may have to access the key health information in My Health Record. This free application can be installed on a mobile phone and tablet, but please note it's not available on a laptop or desktop computer. Residents and any representatives they may have can use the app to view information such as immunisations, medicines and test results on their mobile phone. The app home screen displays several tiles that let them easily navigate the health information in their My Health Record. In addition to allowing access to view information in My Health Record, another great benefit of the app is that residents and their representatives can share clinical documents with you as the resident's healthcare provider. This can be extremely valuable when you cannot access their My Health Record. So how will healthcare providers access the My Health Record system? So you can access the My Health Record in two ways, which we mentioned before. So the first of which is on the left, is accessing it via the clinical information system in your organisation that automatically connects to My Health Record. However, not all software connects to the system. In these cases, your best option would be option 2, which is the National Provider Portal. This still allows secure access to a resident's My Health Record, but via a web-based platform. The platform's a read and download only option, and you can't upload your clinical data into the system in this way. If you're unsure whether the software your organisation uses is able to connect to the My Health Record system, you can look this up on the My Health Record B2B Register of Conformance on the Conformant Clinical Software Products webpage. The Register of Conformity lists software products and the versions that have been assessed for conformance with national digital health requirements. This includes the ability to view a My Health Record, upload a shared health summary, upload prescriptions, provide assisted registration and more. And just also to note that the ADHA have been working with software providers for the aged care industry for a while now, and this is ongoing to increase the number of compliant clinical information systems and electronic medication management system products capable of connecting with My Health Record. So the number of conformant products should increase over time. So on this slide here, I've put in just a screenshot of the My Health Record B2B Register of Conformance. This is one of several pages, and the conformance list is updated very frequently, showing the software product, the software provider and the version, and the type of documents that you can view and upload, and for what's currently available. And just to note that this should improve over time as software developers continue to work with the Australian Digital Health Agency. So on this slide and the next one, this talks a little bit about, can you access your resident's My Health Record? So this is a really common question healthcare providers ask, whether you need permission to access a resident's My Health Record. Any healthcare provider involved in a person's healthcare who is authorised by their healthcare organisation can access a My Health Record. They do not need additional permission of a person to view their record, and a person's record can be accessed outside of a consultation if access is for the purpose of providing healthcare. This also applies to uploading information to My Health Record. A healthcare provider is authorised to upload, however, they must comply with any requests from a resident who does not want information uploaded to their My Health Record. Providers are under no obligation to use the My Health Record system. It is up to your clinical discretion to decide when it might be useful to view or upload information. And next slide, please. Thank you. So I've mentioned representatives in some of the previous slides, and it's important to be aware that a resident may have authorised or nominated representatives that also have access to their My Health Record. So there are two types of representatives, nominated and authorised representatives. First, we'll look at authorised representatives. An authorised representative is a person who has parental responsibility, legal authority, or is otherwise appropriate to act on an individual's behalf. An authorised representative is typically a parent, carer, family member, legal guardian, or someone with enduring power of attorney. An authorised representative has complete access and control over the person's record as if it were their own. They can view, remove and add information, choose whether Medicare information is added to the record, choose which healthcare provider organisations can access the record, restrict access to specific documents within the record or to the entire record, add or remove nominated representatives, view other authorised representatives, cancel the record to delete it. An authorised representative must make reasonable efforts to identify and support the will and preferences of the person they represent. If the will and preferences of the person cannot be identified, an authorised representative must act to promote the person's personal and social well-being. Something to note is that a person can have one or more authorised representatives if they wish. Now we're going to look at the other type, which is the nominated representative. So nominated representatives are people that the My Health record holder or the authorised representative of the My Health record holder can invite to help manage the My Health record. This is a person they trust, and there is no limit to the number of representatives that a My Health record holder can have. Having a nominated representative is especially useful for older Australians who require assistance, people with disability, and people who speak English as a second language. A record holder or their authorised representative has complete control over what a nominated representative can see and do in the My Health record. What they have access to depends on the level of access they're given. And there are 3 access level options. There's general, restricted, or full access. So a nominated representative with a general access level can view documents, except those the person who holds the record has set as restricted access. They can't give another person access to your record. They can't change the access level for other nominated representatives or remove other representatives or make changes to the Medicare information, remove documents. They can't add information. They can't cancel the record. A nominated representative with a restricted access level can view all documents, including the person have set as restricted access. They can't give another person access to your record, change the access level for other nominated representatives, or remove other representatives, make changes to Medicare information, remove documents, add information to, or cancel the record. And My Health Records and Security, there are a lot of resources which I've popped up here on the screen, and we'll provide that when we put this on our website as well. All this information comes off the Digital Health Gov and the Australian Digital Health Agency websites. So privacy and access control settings. So there are some controls at patient level which are an integral feature of the record. Firstly, individuals can choose to restrict access to specific documents in their My Health record. They can then establish a limited document access code, or an LDAC, which they can provide to organisations that they wish to have access to those restricted documents. And they can also restrict access to their record by establishing a record access code, which that will mean that only organisations given the code can access any part of their health record. If it is necessary to loosen or prevent a serious threat to life, health or safety, a clinician can exercise a feature called the break glass function, also known as emergency access. Individuals can also subscribe to SMS or email alerts that report in real time when a new health provider accesses the My Health record. Another safeguard of patient privacy and access is that all instances of access to My Health record are monitored and logged. So My Health record legislation. So there's protection is offered by legislation that governs the way that data is managed by the agency, meaning the Digital Health Agency, and healthcare providers accessing the data it holds. Legislation includes the My Health Records Act 2012, the My Health Records Rule 2016, My Health Records Regulation 2012, and the Healthcare Identifiers Act 2010. And in addition, most healthcare providers have obligations to protect personal health and information under the Australian Privacy Act of 1988. And My Health Records Security. So the system is managed in line with the Australian Government Protective Security Policy Framework. My Health record data is stored in Australia and is protected by high-grade security protocols to detect and mitigate against external threats. The system's tested frequently to ensure these mechanisms are robust and working as designed. Design features include many safeguards to protect the information stored within the system, including audit trails, technology, data management protocols, as well as appropriate security measures to minimise the likelihood of unauthorised access to information in a person's records. In addition to these measures, the system is protected by legislation, which governs the way the system is accessed, managed, and used. The emergency access provision can only be used where the healthcare provider reasonably believes that the access is necessary to lessen or prevent a serious threat to the life, health, and safety of an individual, and reasonably believes it would be unreasonable or impracticable to obtain the consent of the healthcare recipient whose My Health record is to be accessed, or the healthcare provider reasonably believes that access to the record is necessary to lessen or prevent a serious threat to public health or public safety. And please note that emergency access does not need to be used if you can already access the individual's health record using your usual processes. So there are penalties for misuse of information, so it's important to be aware of this. So the record is there to assist providers deliver better healthcare for their patients, and this is the authorised use of My Health record. Appropriate access and use of the record system is taken very seriously. My Health record legislation is all about encouraging the use of My Health record by clinicians and not penalising you. So if you're a clinician providing healthcare, then you are encouraged to use My Health record. However, inappropriate use can result in penalties. And there are significant fines and penalties for inappropriate or unauthorised use of information. Penalties may be applied for a few things such as unauthorised collection, use or disclosure of health information in the record, use of health information in the record for prohibited purposes, unauthorised use or disclosure of healthcare identifiers, or other information obtained for the purposes of the healthcare identifier services. Failure to give written notice within 14 days if the healthcare provider or organisation ceases to be eligible to be registered. You'll need to notify the agency if this is the case. And failure to notify an actual potential data breach in which the healthcare provider or organisation were directly involved. Holding, taking, processing or handling records held for the purposes of the system outside Australia, or causing someone else to do so. So we've got some examples of inappropriate use on the next slide. So emergency access is not designed to be used to check whether any restricted documents exist, except in accordance with Section 64 of the Health Records Act, where the treating healthcare provider reasonably believes that access is necessary to lessen or prevent a serious threat to the individual's life, health or safety, and it is unreasonable or impracticable to provide consent, or to lessen or prevent a serious threat to public health or safety. It's not designed to be used to gain access when an individual has forgotten their access code, except where there's a serious threat to the person's life, health or safety. And it's not to be used to view your own My Health record or a record of a family member. It's important to note that unlawful use of the emergency access function is subject to civil and or criminal penalties under the Health Records Act 2012, and we discussed those penalties earlier. So participation obligations for healthcare providers. So what do organisations need to do? So to participate in My Healthcare record, there's 5 key participation recommendations. 1, all organisations engaging with the My Health record system must have a My Health record security and access policy in place. These must be in place prior to registration into the system. When registering for the system, you'll be required to nominate the roles and responsibilities, including what they call an RO, a registration officer, and the OMOs for your organisation, so organisation management officer, as well as set up your structure within the HI, which is the Healthcare Identifiers Service. This is why it's important to be aware of these concepts prior to the registration process. Once registration is complete, you can then train staff to use the system appropriately and ensure users are authorised to be accessing this My Health records system. It's also important to be aware of the ongoing participation obligations for using the system. There's in-depth information for each of these stages available on the digitalhealth.gov.au website. And the email address for if you need any information or you're interested in registering or you need support in developing a policy. If you've got any questions, please reach out to the RAC registration team via the mhr.registration.rac@digitalhealth.gov.au email address. So this is the medicine slides view. So I wanted to show you just a couple of what the My Health Record looks like inside. So there are some screenshots that the Australian Digital Health Agency have mocked up and provided to us. So on the medicines view slide, this is one of the most used overview documents. As you can imagine, in a resident's My Health Record, there are a lot of medicines information available. This particular view collates information from a range of documents in the record, including the shared health summary, the discharge summaries, event summaries, PBS information, prescription and dispense records, specialist letters, and consumer entered information. Obviously, there are a lot of documents to look through. The medicines view helps as it extracts the medicine information from these documents and displays it in a summarized view. And also those bright blue links as well, they're all hyperlinks. You can actually click on those and go back to the source of the information. On the next slide, you'll see the immunisation consolidated view. So it's similar to the medicines view. It has a navigation panel. The first box provides information from the Australian Immunisation Register. The next box, immunisations, contains information sourced from both the Australian Immunisation Register and My Health Record. Note, this means that a vaccination record reported in a My Health Record document, as well as in the Australian Immunisation Register, may appear twice in this list. And again, there is a link to the most recent shared health summary and an event summary. These would only appear if it had immunisation information, e.g. a tetanus vaccination. Scrolling down the page, you'll also see when the next immunisations are due and any notices. So on the next slide, we've got the pathology reports overview. This allows providers to view reports in a streamlined way. The overview allows you to sort available reports within a specified date range or by test name. This screenshot shows reports grouped by test type, and these search functions allow quicker access to the test results and are displayed in a document list. And again, hyperlinks can be clicked on to take you to the pathology report. And just to note too, with pathology reports and also diagnostic imaging, there will be more and more of these reports uploaded over time. There are some changes coming this year with pathology and diagnostic imaging reports being mandated to be uploaded by the provider. This will take a little while. On the next slide, we've got the discharge summary. So when a hospital creates a discharge summary, this will be sent directly to the intended recipient as per current practices, and a copy of the discharge summary may also be uploaded to the resident's My Health Record. The information contained in the discharge summary can be shared between the resident's doctor, the referring specialist, and a community pharmacy to support the continued care of the resident once they are discharged from hospital. The next slide, we have advanced care plans and goals of documents. An advanced care plan can be uploaded to an individual's My Health Record containing their wishes for future health and care. The individual can also upload an advanced care document custodian who holds a copy of their advanced care planning document. This document contains the details of the contact person or organisation. Some software products used in residential aged care facilities have the functionality to allow healthcare providers to upload advanced care planning information. The goals of care document is created and uploaded by a healthcare provider through a shared decision-making process with the person in their care and family or carer. This is done to capture medical and non-medical goals of care in the context of end-of-life care. And the shared health summary. So this document is uploaded by a resident's nominated healthcare provider, which is usually a resident's regular GP, but it could be a registered medical practitioner, a registered nurse, or an Aboriginal or Torres Strait Islander health practitioner with a Cert 4 in Aboriginal or Torres Strait Islander primary health care. The shared health summary captures the resident's health status at a point in time, It contains medical information in 4 key areas. So allergy and adverse reactions, medicines they're taking at the time the document's created, relevant medical history, and immunisations. And a new shared health summary is normally uploaded when any details change, or it's been a long time since the last one was created. There's also additional information at the end of the document that shows that the contact details of the provider who uploaded the information. And you can also contact them that way as well. An event summary. This might be used to indicate a clinical intervention, improvement in a condition, or that a treatment has been started or completed. Generally, an event summary would contain information about allergies and adverse reactions, medicines, diagnoses, interventions, immunisations, and diagnostic investigations. For example, if you have a resident who has had specialised wound care, you can record the details in an event summary. This means anywhere they get the treatment done, the right dressing can be provided. Any healthcare provider can upload an event summary to an individual's My Health record if they have clinical software and this functionality. And this is the aged care transfer summary that we mentioned earlier. So this is concept design only. So the goals of the aged care transfer summary, this is the functionality coming soon. It's improved point in time, clinical information to provide more effective and responsive transitions of care, enabling access to the most up-to-date shared health information in a standardised and easy to interpret manner, supporting safer and more effective continuity of care, improved medication management practices when treating hospitalised aged care residents, reduced risk of adverse drug events in the transition of care to and from aged care facilities, improved experience for the resident, adherence to their wishes and comfort by allowing access to advanced care planning documents uploaded to My Health record. So this one would be very, very beneficial in the near future. And finally, we just have a couple of slides so that basically it will show you some further information and resources. There is a lot of information and resources available on the websites at the moment. The aged care resources, residential aged care fact sheet, there are webinars, e-learning modules, education resources, information about how to register, how to access the provider portal, conformance software, and lots of links to consumer information such as brochures and guides. And these are the e-learning courses in your area of practice that you can access as well online. So if you click on those links, they'll take you to a series of e-learning modules and webinars, etc., that you can use to complete some training on My Health record. Further information support, the record helpline, there's a phone number there and the contact details. And thank you everyone for attending today. Does anyone have any questions?
I'll take participants off mute and then if anyone's got anything. No, I don't think there's any questions.
This is a lot of information.
Yeah.
So My Health record it's a big topic. It is a journey. There is a process to register and there's a process to get things set up properly and become compliant. There's a process for training. And there is a lot of resources that you can access on the different websites, and there is a lot of help that you can receive from the Australian Digital Health Agency.
Lisa and Branton, just, how would people train if they can't actually view the patient information?
Yeah, this is, thanks, Ali. This is a great question. And often it's quite convenient and easy to get stuck here when you're in your aged care facility and you've got the computer in front of you and you go, oh, I have a resident, I can just go in and have a look. Or I've got a family member. But as Lisa rightly pointed out, there are some rules, okay? And in order to stop you from getting into trouble is to go to those training modules that have been specifically set up for your area of discipline. And I don't know if you notice on that training.digitalhealth.gov.au link, once you register, you have access to dedicated virtual environments that have dummy patients set up in hopefully the conformance software environment that you are used to using. And obviously, when it comes to aged care, that conformant register is slowly improving over time. But there are virtual environments, for example, Manard products. You can go in there and you can see what it's like to upload a shared summary or upload or view an advanced care plan, and you can walk through that in a real life scenario, repeat yourself over and over again to become comfortable.
Okay.
And that's the official training environment. That's safe and secure.
Okay, great. Everyone, there's just an evaluation on the screen. If you'd like to fill that in, be much appreciated. We'll send that out to you all as well, along with the resources from the slides. Anything else, Lisa or Brenton? Are you?
No, I just want to say thank you,
No?
everyone, for taking time out of your really busy day. I appreciate this.
Yeah.
Thank you.
Thank
If you do
very
have any
much.
questions, feel free to reach out.
Okay. Thanks, everyone.
Thank you all.
Thank you.